All right, today we're going to get into the life story of your bones. We're talking about osteoporosis, a condition that affects millions and millions of people, a lot of whom have no idea what's going on inside their own bodies.
So, let me start with a question for you. What if your skeleton, the very framework that holds you together, is, well, weaker than you think? It's kind of a strange thought, but for a lot of people, it's a reality they just don't know about yet.
Now, look at this number, 40%. That's roughly how many women over the age of 50 are dealing with osteoporosis. I mean, that's huge. This isn't some rare, obscure disease. It's incredibly common. And here's the real kicker. Most of them have no clue. Osteoporosis is a silent operator. There are no warning signs, no aches, no pains, nothing to tell you your bones are getting weaker, until suddenly a fracture happens. So what exactly is it? Well, here's the simple definition. It's a condition where your bones lose their density and strength. They become more porous, more brittle, which means even something as simple as a fall or even a really hard sneeze could be enough to cause a break.
Okay, so that's the problem. But to really get a handle on it, we need to think about our bones across our whole life. And the source material we're looking at has this perfect analogy for it: your bone bank.
Just imagine your skeleton has a bank account, but instead of cash, you're depositing strength and bone mass. And all through your childhood and your 20s, you're just making huge deposits, building up this really strong, healthy balance.
And this timeline just lays it out so clearly. You can see the rapid deposits in your youth. Then, right around age 30, you hit what's called peak bone mass. That's your peak balance, the strongest your bones will ever be. After that, well, we all start making these slow withdrawals. And for women, you can see that process speeds up quite a bit for 5 to 10 years right after menopause.
So, the big question is, how do you make sure your peak balance is as high as possible? It really comes down to this checklist. You got to get enough calcium and vitamin D. You need weight-bearing exercise, things like walking, jogging, even dancing. And of course, you want to avoid the stuff that robs your account, like smoking or too much alcohol.
Okay, let's move on to the next chapter of the story. We've made our deposits, we've hit our peak, so what happens when that balance naturally starts to go down?
Now, we just saw this on the timeline, and it's a totally normal process for everyone. But it's that acceleration after menopause that's really key here. It happens because of a drop in the hormone estrogen, which actually plays a huge role in protecting your bones.
And it's not just about agent hormones. There are other things that can speed up those withdrawals. Things like having a really low body weight, or if osteoporosis runs in your family. Even certain medications, like long-term steroids, can have a big impact. And you know, a big red flag for doctors is if you've had a previous fracture from a pretty minor fall.
So if this is all happening so silently, how in the world do doctors figure it out? How do they peek inside your bone bank and check on your balance? It all comes down to a number called a T-score. You get it from a quick scan, it's called a DXA scan, and it's a really simple idea. It measures how dense your bones are right now and compares that to the bone density of a healthy 30-year-old at their peak.
And this table makes it so easy to understand the results. If your T-score is above -1, you're in the clear, that's normal. If it's between -1 and -2.5, that's called osteopenia, which is basically a warning sign that your bone density is low. And a score of -2.5 or lower, well, that's the official diagnosis of osteoporosis.
And if you're picturing some big, scary, loud machine, don't. Getting a DXA scan is incredibly easy. You just lie down on a table, a little scanner arm passes over you, and that's it. It's super fast, totally painless, and uses a tiny amount of radiation.
Okay, now for the most important part. Let's say you get a scan and you get a diagnosis. What do? Because this is not a moment to sit back. It's a call to action.
Your action plan really splits into two paths that work together. On one side, you have the non-medical stuff that everyone should be doing, focusing on diet, exercise, and really importantly, preventing falls. And on the other side, you have medical treatments that can slow down bone loss or even help build new bone.
For a lot of people, the medical journey starts right here, with a type of medication called oral bisphosphonates. You can think of them as putting the brakes on the cells that make those withdrawals from your bone bank. It's usually just a once-a-week pill, but it is a real commitment. Treatment often goes on for at least 5 years.
But here's what it all boils down to, and it's a point the source material makes over and over again. The right plan for you is something you figure out with your doctor. It's a team effort. It's not just about a number on a test.
It's about your life and what works for you.
So, let's pull all of this together. A diagnosis like this might sound scary, but maybe we can reframe it. Maybe it's not an ending, but the start of a brand new, proactive chapter for your bones.
And this is the message I really want you to hear. A diagnosis of osteoporosis is not a sentence of fragility. It doesn't mean your active life is over, it's just knowledge. And with that knowledge, you can start actively managing your bone health and keep living a full, strong life.
So, if you only take 3 things away from our chat today, let it be these. 1. Bone health is a marathon, not a sprint. It's a lifelong journey. 2. Getting a diagnosis isn't a life sentence. It's a powerful tool that helps you take action. And 3, all those proactive steps we talked about, they actually work. They make a real measurable difference.
And so I'll leave you with a final question to think about for yourself. What's one thing you'll do for your bones this week? Maybe it's just adding a glass of milk to your day or taking a walk around the block. What's one small deposit you're going to make in your bone bank?